For any woman who has struggled for years with mystery illnesses, symptoms, and finally get a diagnosis of PCOS, or know that that's been something that's on your mind that you might have, but doctors keep missing it. You're not alone. It's common. Women with PCOS go for years without the correct diagnosis and are typically just sometimes given antidepressants or medications for the pain. Today, I'm going to be talking with Dr. Erica Armstrong, who is an expert not just in PCOS, but in this deep connection between PCOS and the thyroid gland. And it's something that hasn't been, I don't hear talked often enough about. And today we're going to shed some light on that. So, Dr. Armstrong or Erica, if that's okay with you, I'm glad you're here.
Thanks for having me.
Tell me a little bit about how you came to specialize in this and your practice, because you're a conventionally trained MD who at some point there was a fork in the road and you went down a different path.
Yes. So I was practicing family medicine for about 8 years, and over the years, I started to see my patients either just slowly decline despite the best conventional efforts, or they didn't have answers. And a lot of these were women, and they would kind of bounce around between multiple specialists for different symptoms without any clear answers. And then in primary care, you're not only the front lines, but you're also the last resort a lot of the time. And so these women would end up back in my office without any real clear answers, 4 or 5 specialists visits deep, and they would turn to me and say, "What's next?" And that was a very frustrating situation for me because I didn't know, and I didn't have at the time the functional medicine training to figure it out. And so I actually learned about functional medicine from a colleague and went through the training through IFM, and I loved the entire philosophy, the model of care, which functional medicine is about getting to the root cause, figuring out why, and I love solving problems, so it was it was a good fit for me. I started to piece it into, a heavily burdened conventional system, but found that I was lacking time and space and the right advanced testing to really practice this way. And so back in 2018, I started a functional medicine practice, and it was called Root. And the whole idea is about getting to the root cause, which is the core of functional medicine.
And that, though, that frustration that you had with patients obviously is a very real issue. What are some of the symptoms that they would have that you would send them away to a specialist for? And what would they come back and tell you?
Yeah, a lot of times, like irregular periods, the conventional toolkit is often just to like throw the birth control pill at it without understanding why. And back then I didn't really understand why myself. So I would refer them to OBGYN. But the problem was that all the specialists wanted to stay in their lane. So these people didn't only have irregular periods, they also had bowel symptoms like bloating or constipation. They would sometimes have like brain fog, fatigue. They would be gaining weight despite, living a healthy lifestyle. And, they would sometimes come back and they'd be like, okay, well, I'm on the pill, but my mood isn't any better and my bowel symptoms aren't any better, and I'm still gaining weight. My cycles are regular now. I'm on the pill, but I have all these remaining symptoms. And so then okay, so we tried some things with, trying to do simple conventional things with diet for bowel symptoms, like more fiber, water, that type of thing. But that wasn't always effective. So sometimes they'd end up with a GI doctor appointment, and sometimes they'd even end up with colonoscopies because, that's what they do when you go to GI. That's what they want to investigate and do a colonoscopy. And so, most of the time those were without answers. Sometimes they are worthwhile, and sometimes very necessary, but it was just a lot of back and forth. When really, once I learned functional medicine, things just made so much sense. Like, we need to figure out the 1 or 2 root causes here that are causing all of your symptoms. And instead of like 4 or 5 different specialists, you need one good doctor and who can figure things out for you, and one good dietitian who can support you through the changes that are going to be necessary.
So, what are those connections you found with PCOS?
Yeah, so when I started at Root, we actually screened every single member with a lab panel at the beginning, and it's called our root cause panel. And for women who mentioned hormonal issues, we also added like a DHEAS, which is an adrenal hormone that leads to androgen production, and testosterone levels. And we diagnosed so much PCOS based on our comprehensive history taking, plus the lab panel results that had just gone missed for years because the symptoms were kind of subtle. But the other thing that was on that panel, because we do very comprehensive testing up front, was it was a full thyroid panel. And so I actually just kept seeing this pattern like, wow, this woman has PCOS and thyroid. And neither of these things were diagnosed, but we've got it in one visit because I can see your whole history and I can see your lab testing. And it happened so much. I was like, there is a connection here. And then as you get going, down the functional medicine course, you often end up doing other advanced testing like stool microbiome. And then I'd find patterns in the gut that were happening. And that was often a common root cause was inflammation that was starting from microbiome imbalances that was leading to both hormonal imbalances in PCOS as well as thyroid conditions, especially autoimmune thyroid conditions. So the most common reason that people in the US have hypothyroidism or low thyroid is an autoimmune condition called Hashimoto's. So PCOS is strongly related to Hashimoto's. You're 3 times more likely to have Hashimoto's if you're a woman with PCOS. And so this wasn't something that was really written about when I wrote the book, The PCOS Thyroid Condition. But what I was doing was piecing in the things that we were finding clinically and writing it out. And the book goes over kind of how to dig deeper to find your root causes. And that might be gut health, it might be adrenal issues, it might be nutrient deficiencies, mitochondrial dysfunction. And those are all spelled out in the book.
Well, and what is the connection though between PCOS and thyroid? I mean, in terms of the endocrinology of it, how is that working?
It's because they share root causes. And the most common root cause is inflammation by far. We almost always find inflammation when a woman has both PCOS and thyroid. And where is that coming from? Well, it's coming from the spot where the majority of the immune system lives. And the immune system is what produces inflammation. And that is right in the lining of the gut.
And that intestinal dysbiosis though that's going on, when you correct the inflammation, what changes do you see in the labs?
Yeah, absolutely. So it's a combination. So the first thing we do is teach people how to balance their blood sugar, and our dietitians are amazing at this. This is what they do every day. And so we use our root plate method for this. So the first thing we do is balance blood sugar. Right in the first month, we replace the nutrient deficiencies that we find. And then as far as the gut, this is where a lot of the learnings that we've had over the last 6 years and how do we rebalance this gut microbiome? And that's making sure that there's the right balance of good bacteria there. There's not overgrowth of certain bacteria that are inflammatory. It involves functional stool testing to look for things that might be inflaming the gut. And then it is a personalized protocol over the next 3 to 6 months to do that. And what happens is when the inflammation goes down, egg quality improves drastically. And so when you think about how a woman has a period, the first thing that needs to happen is that she needs to ovulate. If you take a step back, you're not going to ovulate if you have a lot of inflammation that's affecting egg quality. So we have to get the inflammation down so that egg quality improves. A natural ovulation occurs. And then if not fertilized afterwards, the progesterone will fall and a period happens.
And when you test, how is egg quality determined?
Well, that is a good question. There's not a great test for it. Some people use like an AMH level. So I'm going to say this wrong.
Anti-Mullerian hormone,
Yeah.
right?
Yes. So women with PCOS actually have sometimes an elevated AMH because
Mm-hmm.
they have multiple follicles. Um, but it's also when it's low. So a low AMH can be associated with um, lower fertility rates. So it's kind of confusing if you have PCOS because you can't really use that one per se.
Right.
Um, the best way to know if you have good egg quality really is if you're having regular cycles.
Okay.
Um, yeah,
Because
that
I think
means
you
you're
said egg
ovulating.
quality improves. So I was just wondering how that's, how you determine that, how you, and maybe me asking what the test was the wrong question. Maybe it's just simply how do you know that egg quality is improving? And it sounds like you're getting more regular or different symptoms when you ovulate, maybe not as painful. I don't know what sort of symptom changes. How would a woman know that perhaps she's getting some improvement?
Yeah, so simply having a regular period, not because you're on the pill. It's very hard to know because the pill periods aren't real periods. It's like a withdrawal bleed.
Yeah.
So pills can be useful for things, but as far as like assessing egg quality by having a regular period, we wouldn't really know that. But if you were not on the pill and you improved your egg quality and you started having regular periods, that would be a really great sign your egg quality's improved.
Got it. And this is a great actually segue to I think a wonderful topic because a lot of women and patients in general, if it's not quantified on a lab test, they have questions about, well, how will I know I'm getting better? How do I know things are moving in the right direction? So what sort of symptoms, what does somebody experience? Because often when they've been with PCOS or any chronic illness, they've been sick for so long that that's become their new normal. They've adapted to just feeling crummy. So how will they know that things are on the right track?
Yeah, and we do something at Root called the Root Symptom Score, and it would encompass all body systems. And so, if you have inflammation, that's where a lot of the other symptoms are coming from, like bloating and brain fog and fatigue, and sometimes stubborn weight gain. And so, we would measure across all symptoms each month to make sure that you're improving. Sometimes this is a good thing. You improve so much that you forget what life was like. So before you started these interventions, and so that will allow you to kind of look back and put a number to how you're feeling, kind of make it a little bit more objective. But really, when you're treating inflammation, your entire constitution just feels more like yourself, or what we hear, like better than I thought I could feel.
And Hashimoto's is considered a chronic. It is a chronic autoimmune disease. And do you see that the antibodies that are tested are, anti-thyroid globulin antibody and anti-thyroid peroxidase antibody? Do you see those lab values improving? My understanding, it takes years, but are you seeing people be able to, if they're on thyroid because of that, come off of the thyroid medication? What's the connection?
Yeah, so we see antibodies lowering all the time. Especially when we start targeting gut health, we'll see those TPO antibodies come down. It depends on how long someone has had autoimmune thyroid, because when you have an autoimmune thyroid disease, your antibodies are attacking your thyroid gland. And if we let that go on for years, that's hard to recover full thyroid function from. If we catch it early, we have definitely reversed the need for thyroid medication in early Hashimoto's, or even kind of reduce the dose sometimes if it had been a bit with having the condition.
And what else do you do though? Then you talked about blood sugar, you talked about gut, thyroid. What are some other connections that are there that need to be addressed with PCOS that are absolutely being missed conventionally?
Yeah, insulin resistance is a big one. With the way the conventional system is set up and who treats PCOS
Mhm.
tends to be OBGYNs. They don't typically have dietitians in their office. And they also don't think about thyroid because that would like technically be an endocrine condition. And so insulin resistance is a very important root cause for both PCOS and thyroid conditions. And that is what I was kind of alluding to earlier about blood sugar balance. That's what we target with a lot of support from our dietitians.
And how is the thyroid then, back to the thyroid? Because I know that's a big emphasis of your book. It sounds like it's a big emphasis in this approach and in your practice. How is that misconceived? What is that misconception in the conventional world? How does that play out when somebody comes to you? are, and you maybe communicate back with their conventional doc, are I guess this is a multiple questions. Like, how do you navigate that? Because if the conventional world is not really um, aware of that, and you're communicating with other docs, are they starting to open their eyes a little bit? Is it getting on their radar? How do you as a practitioner navigate that?
Yeah, absolutely. And we get more and more referrals from primary doctors and OB/GYNs, especially, when their patients are requesting a more holistic approach to things. And over the years, I feel like it's become so much more acceptable what we're doing, because they've seen their patients get better when we send them back, so they know that it works. And I think that's true across the US, not just, here in Michigan where we're located. We actually see people across the continental US online. But yeah, I mean, it's really great that it's at least being accepted, even though I think, conventional medicine, to do it on their own, there's so many limitations. And so, for example, they don't want to check a full thyroid panel
Yep.
for you because most likely that's not going to be covered by insurance, and then you will likely end up with a bill. We've seen bills for thyroid panels like $600. And now you have an upset patient and a doctor who didn't really know that was going to happen. And it just creates it, a lack of transparency around the right kind of testing and what it will cost. And I think that's one of the issues on why there is less screening happening conventionally. And I mean, the other big ones are obviously time and the number of people that they have to see, and everything you order will add more charting time to that. I was in their shoes. I remember how it felt like you're treading water, and you're trying to be a good steward of healthcare dollars as well. And so, you're just trying to do what you're taught. And that's not always consistent with what the person in front of you needs.
And it's also not always consistent with what the medical research and clinical literature show the
Mhm.
patient needs. And that's one of the challenges that I've experienced clinically. You've obviously experienced it clinically, and I think patients are so frustrated because of this dynamic, oftentimes being caught in the middle, not understanding, why a test can't be ordered or won't be ordered, and getting these surprise bills. But also, doctors making decisions of what tests to order, not based on what is in the patient's best interest, but based on what the insurance company will pay for. So that's, to me, one of the tragedies of the way that our healthcare system is set up, because approaches like yours are well documented in the research, and integrative medicine is well documented in terms of the benefits of these nutritional and integrative approaches, and the functional testing. And yet insurance companies won't pay it. I mean, I've got insurance. I'm sure you have health insurance. Yet most of the time for my family, I'm spending out of pocket because they won't cover these labs. They won't cover these approaches, and it's horrible because it's a system that's not based on health and wellness. It's a system based on treating the sickest of the sick, and really not being preventative, but working in a good way. I mean, very excellent when something has to be triaged, when it's dangerous or very advanced. But these chronic conditions, a lot of people are just in limbo. And I mean, how long does it take for somebody to get an accurate diagnosis of PCOS typically?
Over 2 years is what the research says usually. Autoimmune conditions can be 4 or 5 years sometimes.
And a gynecologist, you said, is the one who typically will be seen for this, or will be referred to for this, and the primary care doc is often the gatekeeper if they're not going to their gynecologist for their annual exams. I don't understand why what you've learned, what is well documented. I've talked to other clinicians and been to conferences. Why is that not in the medical education system? Why is it not just conventionally known and implemented? I don't know that you have an answer for that. I think it's everything you said before, but I think you hear my frustration.
For sure. And like I think it's just the breadth of the scope of what you're trying to do in primary care. We're fortunate to be able to niche down. And we don't do primary care for good reasons because we
Right.
wouldn't be as good at functional medicine if we tried to do all of that. I mean, it's a ton to know, and like to stay on top of the most recent advances is difficult. But I kind of want to go back to what you were saying about the lab testing because we do have a solution for that at Root. And we have a PCOS panel, the same one that we used in our PCOS program, that anyone can go on and order. And because of the whole, insurance issue, we don't use insurance, but instead we have really, really great transparent prices. They're often less than a copay. And then what will happen is our team actually interprets that and sends a full written report and recommendations based on the results. So it's another way people are kind of coming up with ways to, get lab testing outside
Right.
of the insurance kind of back and forth and the huge surprise bills. But yeah, I think, ordering that from us, you're going to get a team who's well versed in,
What's on?
in
That's
all that.
fantastic. What's on the test?
Yeah, the PCOS panel will include the two hormones I was talking about for PCOS. In addition, metabolism markers, insulin resistance, like an insulin level, inflammatory markers, some key nutrient levels, a full thyroid panel.
That's great, and that gives you enough information. Then, can you diagnose PCOS based on that? Because my understanding is that's not the You need something different to actually have an official diagnosis.
Yeah, we wouldn't be making any diagnoses with that, but it would sure give you a clue that, you want to print this report and take it to a doctor who would work one-on-one with you. We do have the option to add visits, but you're right, there is a clinical history component that we would have to make sure you met two of the three criteria.
And that's a great way. I mean, what you're offering is fantastic because it gives people access to information, and I think that's one of the most frustrating things is just this lack of access, this disempowerment that a lot of people feel of not being able to get the information for something they're struggling with and being blocked by their doctors from getting that information because they won't order the tests. When you're looking at the test results and you send a panel or the interpretation of that, are you also at that point, because you talked about dietary recommendations and a dietitian, are you giving any lifestyle recommendations, or is it purely just on, at least on that initial lab, just purely evaluating the lab results?
Yeah, great question. The recommendations will have all of that included: nutrition, lifestyle, stress, sleep, and then it will link out to resources that we've built at Root on our Root community. And if you wanted to add a visit with a dietitian afterwards to help you implement it, and we have recipe guides and how to do the Root plate and all of these resources available after your lab testing, you can also add the one-on-one visit if you would like to do that.
That's so great. So great. How can people learn more about your work, find you?
Rootfunctionalmedicine.com. And that's if you click on the lab test, you'll find the PCOS panel on the top. And you can also just order a full thyroid panel as well. It's customizable to your needs.
Yeah, I got to tell you, I don't know that I've ever done I don't think I've ever done an episode where I'm just featuring a clinic and a program that they have, but I'm so impressed with what you're doing, and I know that this is such a, can be debilitating condition for so many women, then they're not getting the help that they need. I don't know of any other company, any other clinic that's doing the type of service that you're doing nationally, so that anybody in any rural, urban, anywhere in the country uh, that may think that PCOS is an issue can now get the information to help them finally start, and not just the information, but programs and guidance on what to do and questions to ask and how to heal. So I think what you've done is absolutely phenomenal. Everybody, who is interested in this should go to your website and check it out. I've spent a little time on there. It's a great resource. Any last parting words where you think something we missed or you want to make sure people know about?
Thank you so much for your kind words and your support. Um, yeah, I mean, if you for more information, you can check out the website, or we're fairly active on Instagram, LinkedIn, and we actually have a podcast as well. It's called Get to the Root.
Oh, phenomenal. I love it. Get to the root. I'll link to that in the show notes also, because I did not have that information before. And I'm going to make a note here. Get to the root podcast. All right. Thank you so much for everything you're doing, and helping a lot of women out there who are not getting the help they need. It's important work. It's amazing work, and I hope that everybody goes to your site and finds the help that they need. Thank you.
Well, thank you so much.